Hi everyone, thank you for joining us on Hope with Answers. I am Dr. Sydney Barnett. I am a stage 4 ALK positive lung cancer patient, and I am here with Dr. Jacob Kaufman. So we've been talking about liquid biopsies, and one of the things I really would like to know is, how do we think that this will help in the future to surveil someone's lung cancer or even their risk of recurrence?
That's a really important question. So the kind of topics that we've discussed earlier are kind of what is this liquid biopsy thing, and how is it being used to help lung cancer patients and to help lung cancer doctors care for their patients right now in June 2022. And the question is, what could we imagine in the future, which is really exciting to think about. For one, these tests change over time. The companies and the researchers that are developing these tests are always looking for the next generation of tests that gives us more and more information, and then ways that we can use that information to better guide our treatments for lung cancer. So one possibility is we've been talking a lot about testing for particular mutations that may be circulating in DNA that was leaked out from the cancer but is detectable in the blood. So that can be very useful. There are researchers that are also developing tests that look for actual cancer cells. Maybe it's a 1 in a million of the cells in the bloodstream is a cancer cell, and there may be useful information that we can get from more sophisticated tests on those cells. But I think that's a little bit of a ways from the clinic. One aspect that could be particularly interesting is using the presence or absence of the information from these tests. So how strongly positive are these tests? Are we detecting tumor DNA at all? Are we detecting no tumor DNA? And using that to understand what the cancer is doing beyond what we can see on CT scans. And a particular case where that might be useful is, imagine we've been talking a little bit about kind of a stage 4 metastatic patient who may have been on treatment for some time, and we're getting information about how we can treat that patient. But there's another situation where maybe a patient has undergone a surgery and has no definite evidence that the cancer is in the body. And we're wondering, did the surgery cure that patient, or are there some microscopic cells that had already left that area and were not removed by the surgery? And that may be an area where doing these liquid biopsy tests and looking for tumor DNA circulating in the blood can help doctors and help patients understand whether they're at low or medium or high risk of recurrence after a surgery. And it's not, I want to emphasize that is not yet something that's standard in lung cancer. This is very much a research question. But there was actually a clinical trial that was just published last week in the New England Journal of Medicine that was looking at this approach in colon cancer and finding that after a surgery, they were able to take the colon cancer patients, and if their liquid biopsy didn't show circulating DNA, in some cases they were able to minimize the amount of chemotherapy they were using, but still get just as good control of the cancer and just as good cures and outcomes by helping to use the liquid biopsy to guide the right amount of treatment for those specific patients. So if we had a clinical trial, and I think that those are probably in the works in lung cancer, and if those show encouraging results, that could very much become part of our routine care in lung cancer down the road, but entirely contingent on the clinical trials in lung cancer showing exciting findings that support that use.
Wow. Well, that was a lot of information, a lot of very, thought-provoking information. I just want to thank you, Dr. Kaufman, for being here, and thank you for being here on Hope with Answers.
Thank you for having me.